we would expect our daily numbers to vary. However, the trend is what is important, and the trend continues to be much lower than that rate that we saw through late March. It means that all of our efforts, all of the sacrifices that we are all making are working, and they're helping to keep our community safe, to keep our community well, and to save lives. Just now, the Chief Health Officer has published her determination of hotspot areas around the country. These are locations where, even if you are a Queenslander, if you have travelled to them, you may be required to quarantine for 14 days on your return to Queensland. These areas are local government areas, largely in Greater Sydney as well as the Central Coast of New South Wales. Of course, if you are thinking of travelling, I'd urge you to check these areas, but more importantly, I'd urge you not to travel in the first place. This is not the weekend for going away. And I was heartened. The highway near here on the day before Good Friday, yesterday afternoon, would normally be chockers, would normally be bumper to bumper, and there was barely a car on the road. Similarly, this morning, the highway is very quiet, and that is good news. It means that people are heeding that call. They're not heading up the coast for the long weekend as they normally would. They're staying around home, and that's really important. Right now in Queensland, there are 897 people in enforced quarantine, spending their Easter weekend in a hold-up in a hotel to keep the rest of us safe. Queensland Police advised me that they have now issued, as of midnight last night, 289 fines for breaches of those public health emergency orders. They are very substantial fines, starting at just over $1,300 on the spot fines. And so there's nearly 300 people regretting, I suspect, their decision to breach those orders. Don't be one of those people. Don't do it, not just because of the fines, but because of the risk that it puts you at. We are all doing this for each other. We're doing it to keep each other safe, and that's a really important message this Easter. Check questions.
Just in regards to those fines, I just want to seek clarification. Queensland Health put up a Facebook post clarifying that you can leave the house for an essential reason to visit close friends and family, no more than 2 people at home. We've had reports yesterday that people were driving from Gold Coast to Brisbane and getting fined when they were going to visit friends and family. Is there across suburbs? Is it only within your own suburb?
We'd certainly encourage people not to be travelling from region to region, and certainly we would consider Brisbane to the Gold Coast are different regions, and we'd encourage people not to travel that far. The 2-guest rule was a concession that we made to make it all a bit more bearable, but it wasn't designed to allow people to travel great distances, and that's what we're trying to restrict here. So those essential purposes are to get food or goods that you need, to take care of somebody else, to exercise. They're the main reasons that people should be leaving their homes. We are allowing 2 guests, but if we find people are abusing that, we might have to revisit that, and we really don't want to. This is not about isolating people from their networks. It's about keeping them socially distant. We'd encourage people to continue to keep in social contact through phone and FaceTime and that kind of thing. We are allowing 2 guests at a time, but we'd urge people not to take advantage of that.
The NRL announced that they're going to be restarting the season on the 28th of May. Did they consult the government on this?
Look, I haven't been consulted on that, but that doesn't mean they haven't been in contact with parts of the government, and I'm sure they are. I'm sure they're trying to find ways to restart the competition in a way that is healthy and safe. I look forward to hearing what that is. I'm sure the Chief Health Officer is available to provide advice to them about that, but I'm not aware of what the plan is, so I can't really comment on the steps they've put in place.
So there's been a few cases of people trying to bypass border crossings and find loopholes in the government's laws. What are your thoughts about those type of people that are actively looking for ways to break that law and find those loopholes?
Look, we're all doing this to keep each other safe, and so by trying to find loopholes, you're really just putting yourself and your community at risk, as well as risking those big fines. So I'd encourage everyone to just do the right thing, take this long weekend at home, spend it with your family and friends in your local neighbourhood. We certainly would discourage people from finding those loopholes. I know that police had to replace some of the water-filled barricades with concrete barricades. That's a real shame that they had to do that, I think, but they have now. Everyone should be aware that the police are out there enforcing all of these rules. They're on the border, they're at the beaches, they're making sure that everyone complies, and I'd encourage everyone to comply as well.
Further to returning to the state, if someone's come from overseas and is quarantined for 14 days in another state, do they need to do that again if they come back to Queensland?
Not provided they travel directly back to Queensland. Obviously, if they expose themselves to the community in another place, well, we'd need to take that into account, especially if it was one of those hotspots. If they're a Queensland resident, though, and they do their quarantine in another state, that is the arrangement. They can travel back to Queensland, back to their home state. Without an essential reason, if they weren't a Queensland resident, they may need to quarantine here if they were to return.
There were reports that a nurse was sent out at the clinic. Do you know anything about this?
I understand that somebody has been charged for spitting at a nurse, and that is important. It's important that people know that the police will enforce assault charges against anyone who puts our health workers in danger. I was, of course, disgusted to hear that report, concerned for the well-being of that particular nurse, but nobody should treat our health workers like that, and they should know, everyone should know, that the police will enforce the law, and as I say, I understand charges have been laid.
Just in regards to ventilators, can you explain the ethical guidelines over who would get a ventilator if, in the unfortunate event, we do see numbers rise again and ICUs potentially overwhelmed?
We're doing everything we can to never face that scenario. I know other countries have, but here in Queensland we are very, very well prepared, and we are acting to ensure that we have sufficient intensive care beds and ventilators for anyone who could benefit from them, and that is our objective, to get that planning. We've ordered extra ventilators, we've identified all of the ventilators available in the state, we have anaesthetic machines that can be converted into ventilators. There are manufacturers here in Australia who are rekitting to make ventilators, and if you look at the current modelling from the Commonwealth, which suggests that the peak demand is still some time away, we have plenty of time to get more ventilators. In fact, that modelling suggests that Queensland's peak demand for ICU beds is likely to be around 1,000. That is less than the current number of ventilated beds available across the public and private systems. So we already have more capacity than we anticipate ever needing under the current scenarios, and we're doing what we can to make sure we have lots more.
There's been some discussion in the federal government, or some media reports, I should say, about some states relaxing or easing restrictions, lockdown restrictions. Is that something the Queensland government is considering? And if not, when do you expect the government will consider that?
So those final round of restrictions, those restrictions that related to requiring people to stay in their home unless they had an essential reason to leave, they were put in place for 1 month in the first instance and will be reviewed after that month. I would expect some kinds of restrictions will be in place for many months, perhaps 6 months, but that home isolation component or home quarantine component, it was put in place for 1 month and will be reviewed at 1 month. The school arrangements, as we've indicated, are currently under consideration, and the Education Minister and the Premier will make announcements in that regard during the week. So we'll be monitoring all of these initiatives, determining which work and which don't, which are more effective than their cost, and keeping those in place, tweaking them where required. And obviously there's been a fair bit of that already, minor variations made over time. We made that alteration, for example, to allow 2 guests.
Gold Coast have released a video, Health released a video of retired Queensland Police officer Kim Watkins. She was released from hospital, the first Queensland patient to be discharged after being ventilated from ICU. Just wanted to get a comment on this good news story.
I hadn't actually seen that, but that is fantastic news. We know that hundreds of Queenslanders have now recovered from COVID-19. We know that most people will recover. 80% of people will only have very mild illness. Maybe 15% will end up in hospital, 5% in intensive care. And we know that if we can get the people who need it into intensive care, such as we have here, then our fantastic intensivists, our intensive care doctors and nurses, they'll save lives. And so that's what this is all about. Most of us won't get very sick if we get this disease, but some of us will, a very small proportion will, if we can get treatment to those people, then we can save more lives. Other countries have seen 3, 5, 6, 7% death rates. If we can keep our death rate well below 1%, well, that will be amongst the best in the world, and that's what we're aiming for.